What if the most powerful blood pressure medication you've never been prescribed is sitting quietly in your kitchen right now? Not a pill, not a prescription, a drink. And here's the thing that stopped me cold when I first read the research. Your blood pressure does something terrifying while you sleep. It spikes silently. And most seniors have absolutely no idea it's happening. Tonight, that changes. Hello and welcome back. I'm Dr. Favor, and today we are going somewhere most health videos never bother to go. Past the generic eat less salt advice, past the exercise more, reminder that makes everyone feel guilty, and straight into something you can actually do tonight before you close your eyes. Now, let me be honest with you right from the start. When I first started looking into what happens to blood pressure during sleep in seniors specifically, the numbers genuinely surprised me. The American Heart Association has reported that roughly 70% of adults over the age of 65 are living with hypertension. 70%. That means if you're in a room with 10 of your peers, 7 of you are walking around with blood vessels under more pressure than they should be. But here's the part that doesn't make the evening news. There's a specific window, those quiet hours between dinner and deep sleep, where what you drink can either calm your cardiovascular system down like a sunset over still water, or quietly rev it up like a car engine left running in a closed garage. Most people are accidentally doing the second thing, and they don't even know it. So stay with me because by the end of this video, you're going to have a short list of drinks, backed by real clinical research, that work with your body during sleep to bring those numbers down. We're talking systolic pressure, diastolic pressure, nighttime cortisol spikes, all of it. And I promise, none of what I'm about to share involves anything weird, expensive, or hard to find. Some of these are probably already in your pantry. Let's start with number 1, and this one absolutely shocked me. If blood pressure had a natural enemy, Hibiscus would file the lawsuit. Hibiscus tea, the deep crimson, slightly tart herbal tea made from dried hibiscus flowers, has been the subject of more serious clinical research than most people realize. A meta-analysis published in the Journal of Nutrition analyzed multiple controlled trials and found that regular hibiscus tea consumption reduced systolic blood pressure by an average of 7.5 milliliters. To put that in perspective, some first-line blood pressure medications show reductions in that same range. That's not a trivial number. That's a meaningful shift in cardiovascular risk. Here's what makes hibiscus particularly clever as a bedtime drink. It contains powerful antioxidants called anthocyanins, the same compounds that give blueberries their color. And these anthocyanins have been shown to inhibit something called ACE, which stands for angiotensin-converting enzyme. ACE is essentially the body's internal valve tightener. When ACE is overactive, your blood vessels constrict and pressure rises. Hibiscus essentially walks up, taps ACE on the shoulder, and says, "Not tonight." One important note, and this was a surprise to me too, hibiscus is naturally caffeine-free, making it ideal for evening use without disrupting sleep. Brew 1 cup about an hour before bed. No sweetener needed if you can manage it, but a tiny drizzle of raw honey is fine and won't undo the benefit. Now, tart cherry juice might sound like something you'd serve at a children's birthday party, but what this juice does inside the body of a person over 60 is genuinely impressive and slightly funny to explain because it works through melatonin. Yes, that melatonin, the same one you buy in supplement form at the pharmacy. Tart cherries, specifically Montmorency tart cherries, are one of the few natural food sources of melatonin. And multiple studies have confirmed that consuming the juice before bed measurably improves sleep onset, sleep quality, and sleep duration in older adults. But Dr. Favor, what does sleep have to do with blood pressure? Everything. Absolutely everything. Poor sleep is one of the most underappreciated drivers of elevated blood pressure in seniors. When you don't sleep well, your sympathetic nervous system stays activated, stress hormones remain elevated, and your blood vessels never fully decompress. It's the equivalent of trying to let air out of a tire while someone keeps pumping more in. A study published in the American Journal of Therapeutics found that older adults who drank tart cherry juice experienced significant improvements in sleep efficiency and reduced markers of inflammation, both of which are directly tied to cardiovascular health. Drink 4 to 8 ounces about 45 minutes before bed. It's tart, yes, But your blood vessels will thank you in the morning. This one feels too simple to be true, and yet the research keeps showing up. Chamomile has been used as a calming herb for thousands of years, and science has finally caught up to what ancient healers apparently already knew. The active compound in chamomile is called apigenin, a flavonoid that binds to benzodiazepine receptors in the brain. In plain language, apigenin tells your nervous system, in the most polite botanical way possible, to calm down. Now, chamomile doesn't lower blood pressure in the aggressive, direct way that hibiscus does. It works more indirectly, and honestly, more elegantly. By reducing anxiety, lowering cortisol levels, and promoting deep restorative sleep, chamomile removes the root cause of nighttime blood pressure spikes rather than just treating the symptom. Think of it less as a fire extinguisher and more as a fire prevention system. A study in the Journal of Advanced Nursing found that participants who drank chamomile tea showed significantly lower levels of anxiety. And more relevant for our audience, research on older adults has shown measurable reductions in generalized anxiety, which is one of the hidden fuels behind chronic hypertension in seniors. 1 cup, steeped for at least 5 minutes, so the apigenin has time to fully release. Drink it warm, breathe while you drink it. That part isn't medical advice. That's just Dr. Favor being practical. Before you skip this one, because you've heard it before, stay with me, because the mechanism here is more interesting than you think. Warm milk is not on this list because of some grandmotherly tradition. It's here because milk contains 3 separate nutrients that have independent, well-documented effects on blood pressure regulation: calcium, magnesium, and potassium. Let's talk about those 3 for a moment, because this particular combination is what cardiologists sometimes call the mineral trifecta for vascular health. Calcium helps blood vessels contract and dilate properly. Magnesium acts as a natural calcium channel blocker, and in a very similar fashion to a class of actual blood pressure medications. And potassium counteracts the blood pressure raising effects of sodium by helping your kidneys excrete more of it through urine. The DASH diet, dietary approaches to stop hypertension, which is literally the most clinically studied dietary intervention for high blood pressure in the world, specifically recommends increasing dairy intake for exactly these reasons. Warm milk also contains the amino acid tryptophan, which promotes serotonin and melatonin synthesis, bringing us back to that same theme of sleep quality being the silent secret weapon against high blood pressure. Low-fat or skim milk is preferable here, simply to avoid the saturated fat load before lying down. Heat it gently, don't bring it to a boil, and you preserve more of the beneficial proteins. A small pinch of turmeric in warm milk, what South Asian cultures have called golden milk for centuries, adds anti-inflammatory curcumin to the equation. That's not a gimmick, that's a bonus. This one is for the overachievers and the people whose cardiologists have been giving them the look at recent checkups. Beetroot juice is possibly the most thoroughly researched natural vasodilator on Earth. The reason is elegant. Beets are extraordinarily high in dietary nitrates. When you consume those nitrates, your body converts them into nitric oxide. And nitric oxide does something remarkable. It signals the smooth muscle cells lining your blood vessels to relax and widen. That widening is called vasodilation, and vasodilation means lower blood pressure. Physics is unavoidable. The data on this is robust. A landmark study published in the journal Hypertension found that just 1 cup of beetroot juice produced a measurable reduction in blood pressure within just a few hours of consumption, with effects lasting up to 24 hours. The systolic drop in some participants was as much as 10 mmHg. That is clinically significant. Now, beetroot juice in the evening rather than morning has a specific advantage for seniors. Nighttime blood pressure dipping, the healthy, natural drop in blood pressure during sleep, is often blunted in older adults, particularly those with hypertension. Consuming beetroot juice a couple of hours before bed supports more robust nighttime dipping, which research has linked to lower risk of cardiovascular events over the long term. One small, honest warning: beets turn urine and sometimes stool a reddish-pink color. The first time this happens, it can be alarming. It is not alarming. It is just beets. You've been warned. Here's where most videos stop. But this is actually where the most important information lives, and I want to make sure you have the full picture. Alcohol is the big one. Many seniors have a glass of wine or a small cocktail in the evening as part of a relaxation routine. And while moderate alcohol has been debated endlessly in cardiovascular research, the consensus on nighttime alcohol is less ambiguous. Alcohol disrupts REM sleep, increases nighttime heart rate, and causes a blood pressure rebound effect in the early morning hours, often between 3 and 6 a.m., when cardiovascular events are already statistically most common. It may feel relaxing. Your blood vessels are having a different experience entirely. Regular black tea and coffee in the evening are obvious ones, but green tea deserves a special mention because many seniors drink it assuming it's totally benign. Standard green tea contains between 25 to 50 milligrams of caffeine per cup. That's enough to blunt sleep quality, delay sleep onset, and keep the sympathetic nervous system slightly activated. If you love green tea, drink it before noon. And excessive water, yes, too much water, right before bed, makes you wake up repeatedly to use the bathroom, which fragments sleep, spikes nighttime cortisol, and undoes everything you've been trying to accomplish with those beneficial drinks we just covered. Let me leave you with a concept that I want you to carry with you, because it genuinely changes how you think about evening routines. Healthy blood pressure follows a rhythm called circadian variation. In most people, blood pressure naturally dips 10 to 20% during sleep. This is restorative. It gives the heart, the kidneys, and the brain a chance to recover from the day's demands. But in a large percentage of seniors with hypertension, this natural dip doesn't happen. These individuals are called non-dippers in the literature, and they carry significantly higher risks of stroke, heart attack, and kidney damage than people whose pressure follows the normal nightly pattern. The reason non-dipping occurs is complex, but poor sleep quality, chronic stress, overactivated kidneys, and inflammation are among the top contributors. Every drink on today's list targets at least one of those contributors. Some target all of them. This is not about swapping your prescription for a cup of tea. It's about stacking the conditions every single night so that your body can do what it was designed to do: heal itself while you sleep. So, to bring this all together, the 5 drinks worth incorporating into your evening routine are hibiscus tea for its direct ACE-inhibiting properties, tart cherry juice for melatonin-supported sleep and inflammation reduction, chamomile tea for its cortisol lowering and nervous system calming effects, warm, low-fat milk for the mineral trifecta of calcium, magnesium, and potassium, and beetroot juice for its powerful nitric oxide pathway that actively relaxes your blood vessels while you sleep. You don't need to drink all 5 every night. Even adding 1 or 2 consistently 3 to 5 nights per week represents a measurable shift in the right direction. Consistency beats intensity every single time in cardiovascular health. Now, and I need you to hear this before you close out, I want you to stay with me for one more thing. Because everything we just talked about, the drinks, the blood pressure, the evening routines, all of that becomes significantly more or less effective depending on something else entirely. Something to do with what's happening inside your body that certain medical tests can actually make worse after the age of 65. There is a video I made that I genuinely believe every senior watching this needs to see next. It's called 4 Medical Checkups I'd Never Get After 65. A doctor explains why. And before you assume that sounds dramatic or exaggerated, it isn't. These are real procedures, some of them routine, some of them widely recommended, that current research is beginning to challenge specifically for older adults. The risks, the false positives, the cascade of interventions that can follow, it connects directly to blood pressure, cardiovascular health, and decisions you may be facing very soon. That video is queued up for you right now on your screen. Do not skip it. It is arguably the more important conversation of the two. I'll see you there.